How to predictably bond a ceramic onlay. I want to start by thanking our sponsors, Colteen, Oral Arts Dental Laboratories, and Romero Dental Seminars for allowing this case series review to be shared with all our followers for free. We are also getting ready for our next, Friday, April 26th and April 27th. This is next week. We will be in the city of Atlanta, Georgia with our Imperceptible Aesthetic Restoration, a direct composite hands-on experience. We still have some spots available, so please don't forget to visit our webpage, www.romerodentalseminars.com, and sign up. Hope to see you soon. We also want you to visit our YouTube channel and to share our YouTube channel with colleagues and friends. Don't forget to subscribe to our channel and to hit the bell so that you could get instant notifications every time we upload a new video. Our objectives for today: how to prepare the restoration, how to prepare the tooth, and how to bond the restoration. So let's get started with step one: how to prepare the restoration, how to prepare a ceramic restoration. So there's two things that I want to share here with you, and one of them being you receiving your partial coverage or your full coverage restorations in a glass ceramic, and they have not been etched by the lab. Now, I do want to say that this is my preferred method. I like to ask my lab not to etch my ceramic restorations so that I can have control in my practice on when and how to do this. Again, this is all these steps are very critical, and if they're not done correctly, they may create a problem in the long-term prognosis of your restoration. You may think you may want to know exactly how much time they are allowing that hydrofluoric acid to stay within that intaglio surface of the restoration. And as we know, if we're using lithium disilicate, we want that to be no more than 20 seconds. And if for whatever reason the lab is either under etching or the majority of times over etching the intaglio surface of the restoration, this is going to affect the bond strength between this restoration and the tooth structure. So for that specific reason, I like to have this under my control. So I ask my lab not to etch my lithium disilicate restorations, and that's what you're seeing here. And this is what I'm going to walk you through right now. This is going to be my first tip. So for this particular case, I have an onlay restoration. You can see that this onlay has covered both buccal and lingual cusp, but it has not removed the bioring of the tooth. So it's only an occlusal restoration and an interproximal restoration. This restoration is made out of lithium disilicate and was not etched by the lab. So step number one, I'm going to try in the restoration, make sure that I'm happy with the way that it sits, make sure that I'm happy with the interproximal contacts. And once I'm ready to deliver the restoration, then I'm going to go ahead and move forward with the hydrofluoric acid etching of this restoration. There's many concentrations of this hydrofluoric acid. Some of them are 5%, some of them are 9.6%. You know, many people like to use the lower concentration for lithium disilicate. I don't really think that the difference is that critical, that important. The most important thing is the time of etching. For this particular case, I'm using 5% hydrofluoric acid, and I'm going to leave it in the intaglio surface of that restoration for 20 seconds. Immediately after those 20 seconds, we go ahead and rinse, and that's what you're seeing on my third photo on the right-hand side. What you're seeing is that white, frosty surface, intaglio surface of the restoration that is a consequence of the hydrofluoric acid etching. Now, I do want you to know that many of that white layer that you see within that intaglio surface is a white precipitant that we want to remove, that we want to make sure that we clean, we get rid of that white precipitant, and we leave a very nice and clean etched intaglio surface. So what do we do for that? Well, right after that hydrofluoric acid has been rinsed off and you bone dry the restoration and you see that white frosted surface, we go ahead and we're going to use phosphoric acid. I'm going to share with you here two steps that are critical. The first one, the phosphoric acid, you're going to apply that phosphoric acid within the intaglio surface of the restoration, and you're going to leave it there for 1 minute. 1 minute later, you're going to rinse and bone dry, and that's exactly what you're seeing on the middle photo. you can see that I've been able to remove the great majority of that white precipitant that was produced. That's a salt that is produced as a consequence of the etching of the glass. And right after this, you don't see this in this photo, but right after this step, I'm going to place this in this restoration in a small plastic container with some alcohol, isopropyl alcohol, and I'm going to seal that container, and I'm going to put it in my ultrasound for 5 minutes. So the cleaning process is not only based on the phosphoric acid, but the cleaning process is based on the combination of the phosphoric acid and the ultrasonic cleaning for 5 minutes in a container with alcohol. You can also use distilled water. I personally like using alcohol. It's easier to dry, but you can use either alcohol or distilled water. Once that you remove from the ultrasound and you bone dry, now you're ready for that third step that you're seeing on this photo on the far right hand side, which is the application of the silane. And that application of the silane is just one coat of silane within that intaglio surface of the restoration. Allow the ceramic to absorb some of that silane, and then with a gentle stream of air, you can go ahead and eliminate the solvent. The most important aspect is that the interaction between the silane and the intaglio surface of the restoration should be no less than 60 seconds. So again, we really completed 6 steps. You saw from the day that we received the restoration, the trying, the hydrofluoric acid. We have now the precipitant, cleaning it with the phosphoric acid. Now you put it in the ultrasound for 5 minutes in alcohol. You remove it from there, you dry it, and you apply the silane. Once you apply that silane, again, you want to leave the silane undisturbed in that intaglio surface for at least 60 seconds. And now what you're seeing on the left-hand side is the actual restoration, the same one that I've been sharing with you right now, completely cleaned and protected. That intaglio surface is completely protected from with that silane. So it's completely protected. It's ready for the next step, which is the bonding step. Now I get this question all the time, and the question is, I share with you that I normally do my etching process. So I try in the restoration and I etch it after my trying. But I want you also to know that you can get all this ready. You can etch the restoration, you can clean the restoration, you can silanate the restoration, and you can have it now protected with the silane, and then move forward with your trying, rinse and dry, and then go to the next step, which is going to be your cementation, which we're going to talk a little bit in a couple of minutes. So for this particular case, again, I did my trying before the etching, but you can also do your trying after the silanization. So after the entire procedure of cleaning and silanization of your restoration. What you're seeing here on these right-hand side photos, you can see my onlay restoration delivered on that first molar. And on the first photo, you can see the occlusal view. But on the right-hand side, you can see a lingual view where you're seeing that biorim that has been kept intact. So this partial coverage restoration has still that full strength of the tooth. This is a biomimetically restored tooth, and we've decided to maintain that strength of the tooth by using a partial coverage restoration. So another option that you have is that many of you may get your restorations etched from the lab. So you receive your restoration, and the restoration has already been etched with hydrofluoric acid from the lab. If that is the case for you clinically, the question would be, what do I do? Do I need to re-etch the restoration after I try it in with hydrofluoric acid? And the answer to that question is no, you don't. So what you want to do here is, because you've already received your restoration etched from the lab, my recommendation would be, first, go ahead and clean the restoration with the phosphoric acid. You are normally going to see that restoration with that white precipitate salt on the intaglio surface. So just go ahead and use your phosphoric acid for 1 minute. That is exactly what I'm doing right here. After that phosphoric acid etch with 1 minute, just to clean the intaglio surface or free it from that precipitated salt, go ahead and move forward with your ultrasound. You're going to put it in that container with either isopropyl alcohol or distilled water, and you're going to ultrasound it for 5 minutes. You're going to get it out, you're going to bone dry it, and now you're going to silanate that intaglio surface. So once it's silanated, remember what I said initially, you can then go ahead and try your restoration in, because you've already have protected your etched surface with the silane. So if you are receiving your restorations etched from the lab, just go ahead and do that second step as I just explained to you, and you're going to be good to go from there on. So my step number 2 is how to prepare the tooth. So we've already done the restoration. The restoration is ready for us to deliver. How do we prepare the tooth? So again, I'm sharing with you here a onlay preparation. I've kept that functional cusp because the cusp was thick enough. It had a base greater than 4 millimeters, and it had a lot of enamel and a good amount of dentin also. So what I did is I did a core buildup based on biomimetic principles, using immediate dental sealing, using a resin coating layer, and then applying a fiber, a polyethylene fiber that you're seeing right here. That's a ribbon fiber. And with that polyethylene fiber, I applied a couple of layers of, in this particular case, Brilliant Everglow in less than 1 millimeter thickness, a couple of layers of Brilliant Everglow to get everything to be nice and smooth and round. This is now the second appointment. So I've done the preparation during the first appointment. I scanned the preparation and I put a temporary on. But then the patient comes back. I receive the patient. I remove the preparation, and you can see how clean that tooth is. And the reason why the tooth is very, very clean is because I always remove any debris, any plaque, any remaining cement, and obviously I roughen that surface of that core buildup that I was able to build a couple of weeks prior with my immediate dental sealing. I clean all that with this machine called AquaCare, which is I use a combination of aluminum oxide, 29 microns at 1.5 bar, combined with distilled water. So it's a nice spray of water with the aluminum oxide incorporated within that water. And you can see how beautifully and how nice and clean I was able to get the tooth. Now you're also seeing a little bit of my fibers exposed. That means that my final layer of composite on top of the fiber was somewhat thin. And when I was cleaning, you still get a little bit of the abrasion caused by the microabrasion properties of the aluminum oxide. So a little bit of the fiber was exposed, but no worries. I go ahead. I use now phosphoric acid to clean all the preparation, and most importantly, to etch the enamel. Because during my immediate dental sealing, there was no phosphoric acid step used because I was using a 2-bottle self-etching system, like the one that you see here on the lower right-hand side of my screen, which is OptiBond Extra Universal by Kerr. So now I'm applying my phosphoric acid. I'm etching my enamel. I'm cleaning also the restoration with any particles left of the aluminum oxide on that core buildup. I rinse and I dry. My etching is for 10 to 15 seconds. I rinse and I dry. And now I'm going to apply 2 coats of the primer and the adhesive of OptiBond Extra Universal on top of the enamel and on top of my either resin coated layer or my core buildup, as you are seeing on that photo on the right hand side. So right here, I do not light cure. I leave my adhesive there. I like again 2-step primer and adhesive, and then I go ahead and I go to my step 3. So again, keep in mind, I have not light cured my adhesive yet. Obviously, I'm breaking this down for teaching purposes, but in a clinical reality, you do this one step following the other. So the following step is going to be, how do I bond my restoration? How do I make this bond? I mean, I've done everything right now possible to make this as strong as bond as possible, starting with my biomimetic approach on the substrate of that dentin during my preparation, and the fiber reinforcement to have a fail-safe zone. But now I got to do my delivery of the restoration, and I also want to try to increase as much as possible my bond strength to the remaining tooth structure. So what I'm going to do here is that after I applied the 2-step adhesive system and I did not light cure, during all that time, I have placed a compule of Brilliant Everglow, and I normally use a shade between A3.5 and A4. For this particular case, I'm using an A4, and I place it on my calcet composite warmer, and I put it at the highest temperature, which, if I'm not mistaken, is around 152 to 155 Fahrenheit. I leave it there maybe around 3 to 5 minutes. So when I am ready to deliver the restoration, I'm literally injecting this composite, this micro nano hybrid composite within that intaglio surface of the restoration. But because it was warmed, it was heated, it really comes out very nice and flowy out of the compule. And what you're seeing here is I am now seeding my restoration, and this resin, this composite that is warmed, you can see how it really expresses itself out through the margins, sealing everything very nicely. But the most important thing is that and I forgot to mention this, you have to ask your lab technician to give you at least 200 microns of dye spacer on your restorations. Because if you're going to use this warm composite is more viscous than regular dual cure resin cement. And that viscosity requires more space in order for you to allow you to fully see this restoration, and have to do a minimum minor adjustments on the occlusion afterwards. So please keep that in mind. So I've heated my composite 3 to 5 minutes, 155 Fahrenheit. I inject the composite within the intangular surface of the restoration, and now I'm pushing that restoration to fully sit on my preparation, and you can see how it is expressing itself out of the margins. It is the easiest composite to clean. Again, if you've never done this, please give it a try. It is the easiest excess composite to clean, because this composite, don't forget, is 100% light cured. So you're not going to have the dual cure properties. You're going to have a lot of time for you to clean, to floss in approximately. But most importantly is the consistency of the composite that allows you to clean it so easily and not have, a lot of the remaining regular medium viscosity dual cure resin cement, splashed all over your preparation, and making it sometimes really difficult for you to clean. Not to mention that it is dual cure, so the activation of polymerization just happens by mixing the base and the catalyst. So here you're going to have a lot more time, but you also have to be worried that you're going to have to cure through that ceramic. You're going to have to cure longer. So what I normally do is that once I remove all the excess, I go ahead and I cure 30 to 60 seconds per surface. So I do 30 buccal, 30 occlusal, 30 lingual, and then I come back to the buccal, 30 more occlusal, 30 more lingual, and then I just start cleaning, removing the excess, remove the rubber dam, adjust the occlusion, polish my final restoration, and what you're seeing on the far right hand side of the screen is the completed restoration. So again, this makes it a lot easier. You just have to give it a try, but keep in mind that spacer, the dye spacer thickness that you are required to request from your lab in order for this to happen without any issues. Now, in my practice, I do a lot more onlay restorations than full coverage crowns. I have to sometimes replace crowns, or sometimes I have severely broken down teeth that I want to give them another chance. And this is a clinical example of that. I want to just walk you through the whole process. You're just combining the concepts of preparation and final delivery of the restoration, just to make some points, maybe just to clarify some questions that you may have, just because I specifically spoke about the actual cementation or bonding of the restoration. But this is a different case. You can see this patient had a vital tooth with a crown. The crown literally shattered out of the patient's mouth, fractured to the gum line. There was some of the pulp exposed. I sent the patient to the root canal specialist. They did a root canal for me. Send the patient back. The patient was adamant that they wanted to try to save the tooth. The root was a really good root. Nice and long root, well treated by means of a root canal. Ideally would have been to have the more tooth structure and the tooth vital, but you don't have a lot of tooth structure here, and the tooth has lost vitality. So the question is there any way from a biomimetic standpoint that I can restore this tooth? And the answer to that question is 100% yes. So first thing you got to do is you got to isolate. You got to make sure that you can place a rubber dam, that you can invert your rubber dam underneath the sulcus, so that you have really good clean access to the fractured tooth. You can see also the temporary cement left behind by the endodontist, and I think that there was also a cotton pellet in there. So what I did is I removed that temporary cement. I went ahead and applied my caries detection dye, just to make sure that I had a nice clean peripheral seal zone. You can see that there was a little bit of decay still around my peripheral seal zone. Keep in mind that in the center of the tooth, near that pulp chamber where the pulp chamber was, there's a lot of collagen fibers there, so you're going to get some staining there. So I'm not going to go. You're just removing all the dentin there, because you will end up with no tooth structure. But I 100% certainly want to make sure that I have a nice and clean peripheral seal zone. The patient had some composite here and there left from the previous core. I remove any remnants of that old composite. And once I applied the caries detection, I maybe 2 to 3 times. It was very easy and quick for me to get what you're seeing right here, a beautifully and nice peripheral seal zone. Once I get to that point, and because we're not going to use any phosphoric acid to etch this dentin, I'm going to use my aqua care in this step just to go ahead and remove that smear layer. This is going to definitely increase my bond strength. Again, I'm going to mark it right here. There is the aqua care. I've cleaned with the aqua care. You can see how nice and clean that surface is now. And now I have what we call the peripheral seal zone, where I'm going to get my greatest bond strength. And in this particular case, because it's an endo-treated tooth, you don't want to have any decay left behind. You want to have everything nice and clean. But because there are some more collagen fibers in this area right here where the red mark is, where you have more of that collagen fibers, because that's the pulp chamber. That's the type of dentin that you're going to have there. It's very deep dentin. So you're not going to have a lot of hydroxyapatite on that on these collagen fibers, or mainly on the peritubular dentin. Obviously you're going to have less of a bond strength. So that's the area where I want to try to in one way, shape, or form increase my bond strength there. So what I'm going to do now, again, same steps. I didn't etch the dentin. I used aqua care to clean the smear layer. I'm going to apply my 2-step bonding system, and the one that I use is OptiBond Extra Universal. Step 1 and step 2, the primer and the adhesive. Once I have both, I light cure, and then my next step is going to be my resin coating layer. I use Brilliant Everglow Flow for my resin coating layer, and this is just a layer of flowable composite. You want to make sure that it's less than 1 millimeter thick, and in order for you to be able to see if it's less than 1 millimeter thick, the way that I recommend you do it is just use a periodontal probe, sink it into your flowable composite, and make sure that you can see that 1 millimeter mark. It's telling you right there that you are less than 1 millimeter, and that's what you want to have. You go ahead and apply, and I apply that resin coating layer all over the dentin. Once I have it and I know that it's less than 1 millimeter thick, I go ahead and light cure. And now you can see this 4-minute mark right here on my lower left side of the screen. Now is my waiting time. And this 4-minute waiting time, what it allows is for my hybrid layer to mature. I want to make sure that I don't put any composite layers on top of this. I don't want to put any curing light on top of this. If you have, I don't know, sometimes what I do is I put my timer and I leave it 3 minutes. And then when 1 minute is left over, I start placing my fiber, because that's going to take me 1 minute at least to get the fiber in the right position. But I don't light cure that next layer of composite until those 4 minutes have gone by. Those 4 minutes are telling me that I have now accomplished at least 90% of the bond strength to that dentin. And that's really when I want it, when I feel comfortable that I can apply consecutive layers and that I can light cure these consecutive layers to, again, try to obtain the greatest bond strength as possible. So while I'm waiting for those 4 minutes, I go ahead and I section my fiber. I'm using ribbon as my polyethylene fiber, and you can see that I've cut my fiber. When I look at the photo, you look at these blow up photos, I think it would have been better for me to cut the fiber maybe a little bit longer. The tooth, I did have maybe a millimeter to a millimeter and a half of tooth beyond the gingival margin. You can see my clamps, and you can see the amount of tooth structure beyond that gingival margin. So I felt comfortable that I was applying my fiber at the right level. If you have less tooth structure and you can prepare more your pulp chamber, you may want to sink your fiber maybe 3 millimeters within that pulp chamber, or you may even remove 3 millimeters of gutta percha from one of the canals, and you can stick your fiber in one of the canals first, and then use another fiber to do the wallpapering technique, and in that case use 2 fibers. There's multiple ways that you can do this, but I felt comfortable doing it for this particular case with following this technique that you're seeing right now. And the way that I do this is I place a little bed of flowable composite of a Brilliant Everglow Flow. Then I place a thin layer of the Brilliant Everglow Nano Hybrid Composite, and then I place my fiber on top of both of these layers without curing. using a micro brush and a little bit of the adhesive of OptiBond Extra Universal. I tap on that fiber. I make sure that I'm pushing it against the composite so that everything is nice and uniform and I don't leave any voids behind. And I'll show you the x-ray at the end of the case. And this is what it would look like. You can see that I've been pushing my fiber within that bed of a combination of flowable and nano hybrid composite, both brilliant everglow. I'm pushing that fiber with that micro brush. And once I feel that I'm happy and everything is nice and uniform, I go ahead and I light cure. When I light cure, again, just to remind you, I know that my 4 minutes have gone by and my timer, which I use, has already, rang its little bell. So now I'm ready for the next step. And my next step is going to be to build that core. And I'm going to build this core with subsequent horizontal layers. These layers, I don't want them to be more than 1 millimeter thick. Again, I'm trying to decrease the C factor on that hybrid layer. As if you were to look at this as a plate, you know that if you were to look at geometrical figures, if you have a bowl, the bowl is going to give you the greatest C factor because you have a lot more walls. But this preparation is more like a plate. If we go back one photo and you look at that photo, that looks more like a flat plate. So I'm literally placing my composite layers 1 millimeter thick over a flat plate, which is going to give me the least amount of C factor. So what I'm trying to do is I'm trying to control the C factor at the time of me building up my core. And my core doesn't have to be that tall. Again, this is a biomimetic approach to restorative dentistry. I'm only looking for maybe 3 millimeters of gingival occlusal height. I want everything to be nice and round. I don't want any sharp angles. I just want my restoration to fully sit and to bond to this core, which is really what's going to keep this restoration in place. Now, is this a bulletproof type of restoration? Is this never going to fail? As we know, teeth that have been treated by means of a root canal with this type of approach, and even if you use just traditional dentistry, using a core, post and core within the canal and trying to get a little bit of ferrule effect, you're still going to have some movement every time that the patient is biting. You're going to have some resiliency within the cement between the crown and the tooth and the post and the root canal system. So, I don't tell my patients that this is going to be, a lifelong restoration. But what I do tell them is, I really don't see this restoration having any issues, to be honest with you. But what I do tell them is that there is a fail-safe mechanism within that core buildup, which is built with that fiber that you saw me using. And if the crown comes out, I can either try to rebond it or I can do a new crown, because I would see it would be very rare that this is going to be a catastrophic fracture compared to a more traditional approach with post and core, which normally, if there's any failure, it's going to be a catastrophic failure, and immediately the tooth is going to need to be extracted. So that's exactly the way that I explain it to my patients. So now I go ahead and I remove the rubber dam. I do a very fine chamfer around the preparation, making sure that everything is nice and round. Pack some cord, scan the preparation, send it to the lab. I put my temporary on, and this type of temporaries, I bond them. I fabricate my temporary, placing a thin layer of Vaseline on top of my core buildup, because don't forget, the core buildup is composite. The temporary that I'm going to use is bisacryl, which is also a composite. It's a resin, so they may bond together, and I don't want that to happen. So I'm going to put some Vaseline on the prep. I go ahead and put my bite registration material inside the patient's mouth, fabricate my full crown temporary as you're seeing on the photo, and then I go ahead. I don't clean the Vaseline from the tooth. I just leave it there, and I use flowable composite to bond the temporary to the core buildup. It gives it a really good bond. Rarely do I have patients coming back for me to, re-cement any temporary. This also allows the tissue to heal nicely, for them to clean, to do everything they need to do. The only thing I do tell them is that not to, if they're gonna use floss, just to push, to pull the floss to the side, not to bring it down. But I try to tell them, just don't use any floss for a couple of weeks. Just brush that area very nicely. Maybe some small soft picks to clean it approximately. Other than that, you don't need to do anything else. Now I have the restoration in my office. 15 days later, the patient comes back. I isolate again. You can see I was able to remove that temporary very easily. Sometimes you can see a little bit of the flowable composite remaining here and there. You just flick it off with a spoon excavator. Then I come back and I use the aqua care again, and I clean and I create very small porosities on this core buildup, so that there's better interaction between the resin composite that I'm going to use to cement and the core buildup. And how do I do that? Again, using the same AquaCare 29 micron aluminum oxide 1.5 bar combined with distilled water. And then I apply my both primer and adhesive, just like I shared with you previously. Do not light cure. I heated my composite, inject the composite within the crown, sit the crown. Don't forget about the 200 micron that you have to ask your lab to give you as a dye spacer. I sit the crown, remove all the excess, clean everything nicely, use the floss in approximately like your 30 seconds buccal, occlusal, lingual, and then repeat 30 seconds buccal, occlusal, lingual. Remove the rubber dam, adjust the occlusion, do any polishing that I need to do, and I just go ahead and send the patient home. So, I wanted to share with you also the x-rays. What you're seeing on the left-hand side is the the periapical x-ray after I bonded the temporary using flowable composite. So this is the same day that I did my core buildup and that I obtained my scan. You can see that there is no space in any of the layers. Everything seems to be nice and uniform throughout. You're not seeing the fiber in the x-ray because the fiber is placed from buccal to lingual, so the x-ray beam is just going through it. But I want you to take a look at the tooth on the right hand side. I also restored this tooth with a biomimetic approach using just direct resin composite. And you can see this line right here because I placed, in this particular case, I placed my fiber, my polyethylene fiber, on the axial wall. And then this is the PA, the periapical x-ray. Again, you're seeing here now the completed, the final restoration, fully seated, bonded. Everything is nice and clean. Everything is nice and uniform. One solid buildup with the fiber reinforcement. And again, you're seeing this little shadow here. That is the fiber on that neighboring tooth that I also placed in that axial wall when I was restoring that premolar. So with this was my last photo. I hope that you enjoy today's case review, and I hope that you also can apply any of the techniques that I'm sharing here with you, tomorrow in your next in your next clinical case. And I hope to see you soon back into my channel. Thank you very much and have a great weekend.